Hey everyone, and welcome to This Explainer. Today, we're mapping out one of the most profound, literally game-changing shifts in human history. We're going to look at how a society's economic engine completely rewires its population size, its age structure, and ultimately, what puts its people in the ground.
Okay, let's dive right into our roadmap for today. We're going to start with what the demographic transition actually is and the 4 stages of change. From there, we'll look at the shifting population pyramid, the epidemiologic transition, the changing causes of death, and finally, we'll wrap up by asking if mortality rates actually tell us the truth. Let's get started.
So, part 1. What is the demographic transition? Understanding the shift. At its core, the demographic transition is basically the process where a society shifts from having really high birth and death rates down to low birth and death rates. And, this isn't just some random coincidence of nature. These massive population changes are a direct, undeniable consequence of economic and industrial progress. As a country builds up its infrastructure and its economy, its fundamental human footprint completely changes.
Let's move to Section 2 and see how this builds the 4 stages of change, a chronological evolution.
Right. So this transition isn't an overnight flip. It happens in 4 distinct measurable phases. First up, the pre-industrial stage, spanning roughly the first 50 years of our timeline here, with high birth and death rates driven by unpredictable things like famines. Then we hit the early transition stage. This is where basic sanitation and medicine come into play, and death rates just absolutely plummet. But because birth rates stay high, we get this massive demographic explosion.
So the crucial point is, what hits the brakes? Well, that happens in the late transition stage. Birth rates finally start to drop, mostly due to increased access to family planning, rapid urbanization, and the integration of women into the workforce. And ultimately, that all leads us right into the post-industrial stage, where both rates are low and the population finally stabilizes.
Moving right along to Section 3, the shifting population pyramid, or the metamorphosis of age.
Now that we've looked at the macro changes in population size, it's wild to see how these stages literally reshape a society's age structure. Think of society like a giant shapeshifter. In a pre-industrial world, the age pyramid has a super wide base of children, but a really narrow top because of low life expectancy. But as society industrializes, that base actually contracts from having fewer births, while the apex expands massively as citizens live decades longer. So we end up with an aging population.
But right in the middle of that transformation, during those intermediate stages, something incredible happens. It's called the demographic dividend. It's this unique, temporary window of opportunity where a massive chunk of the population is concentrated right in the working age bracket. It acts as a major hook for rapid economic growth before the population inevitably starts to age.
Okay, Section 4, the epidemiologic transition, a paradigm shift in health.
So, we've talked about who makes up the population, but now let's zoom in on what actually makes them sick. Running exactly parallel to the demographic transition is a companion concept theorized by Abdel Omran called the epidemiologic transition. It basically describes this evolutionary handover in human health, shifting from what he called the age of pestilence and famine straight into the age of degenerative and man-made diseases.
And this brilliantly illustrates that total shift in morbidity. On the left, you've got traditional societies battling acute, infectious, and seasonal outbreaks. But on the right, industrialized societies are facing chronic, long-duration illnesses, things like hypertension, obesity, arthritis. When people spend decades managing these conditions, healthcare has to completely pivot from treating temporary epidemics to sustaining continuous, long-term care.
Which brings us to Section 5, changing causes of death, the primary executioners.
Let's zoom all the way into the final layer here and compare the ultimate causes of mortality across these different economies. The contrast is honestly stark. If you look at developing countries, the primary killers are communicable and maternal conditions, things like lower respiratory infections, malaria, malnutrition, and tragically, these strike a significant percentage of people in childhood or their reproductive years. Compare that to established market economies. Over there, the culprits are chronic non-communicable diseases, cardiovascular issues, cancer, Alzheimer's, and they strike overwhelmingly at advanced ages.
This is a complete survival paradigm shift. Our greatest threats cease to be exogenous factors like external pathogens, parasites, or a lack of sanitation. Instead, they become endogenous factors and our own behaviors. In modern societies, we've basically traded the immediate risk of a parasite for the long-term risks of a sedentary desk job, tobacco use, and chronic stress.
Section 6. Do mortality rates tell truth? The reality versus distortion hook.
Now, what's really interesting about this slide is a critical question we have to ask about the numbers themselves. Even assuming the reporting is 100% accurate, do mortality figures actually give us a realistic picture of a nation's overall health? Well, the answer entirely depends on where a country is in its transition.
In rural or developing societies, mortality data is highly realistic. Why? Because the disease burden there is incredibly acute and fatal. If someone contracts cholera or malaria without access to treatment, death happens rapidly. So in this context, the cause of death registry is a highly accurate mirror of the living population's health. It directly points you to the underlying public health infrastructure failures.
However, and this is a big however, in industrialized nations, mortality figures are grossly distorted. In these economies, daily morbidity, like everyday suffering, is largely disconnected from immediate mortality. Severe conditions, think major depression, severe osteoarthritis, or early dementia, cause immense suffering and have massive economic costs. But because they don't kill you directly, they just don't top the mortality charts.
The real-world impact of this distortion is just massive. Think about it. If a public health minister in a developed nation relied solely on mortality data to allocate their budgets, resources would flow almost exclusively toward cardiology and oncology. That narrow focus completely blinds the system to the mental health crises or the musculoskeletal epidemics that are actively stripping away the quality-adjusted life years, the actual healthy, happy years of the living population.
And that leaves us with a provocative thought to wrap up today's explainer. When you look beyond the basic mortality statistics, what unseen chronic conditions are stripping away the quality-adjusted life years in your own community right now?